Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit. Delighted to welcome you to our second webinar, Standing on the Shoulders of Giants. Delighted to join Tom Ashfield. Tom, very welcome to our second webinar. This one is all about investment, sustainable investment in healthcare. Just give people a flavour of yourself and tell us about what your week's been like and what you plan to do for the weekend.
Yeah, thanks, Gareth. Just to mention on the last one, I really enjoyed it, and I think we got a lot out of it ourselves. We ventured through something, and yeah, thanks for that. So yeah, this is a particularly busy week at the sort of as it melts what I'm doing together. So I play a lot of music. This is a guitar I'll be playing this weekend. So I've actually got 3 events in 4 days. Tonight we're at Bath Racecourse. A reggae night, and then I'm playing with Bristol Reggae Orchestra at a place called Valley Fest tomorrow, and then I'm coming on to a fundraiser we've got, which is probably our mutual activity that's probably kept me most busy. Is on Tuesday we have a fundraiser for Hurricane Beryl, which decimated one of the small islands in the Grenadine, Carriacou and Petit Martinique. And we've had an overwhelming response. We've had BBC Radio Bristol, we've had it on, all stations have been given a beautiful venue. And really, this is about infrastructure. So it all relates today to what we're talking about today. When you've got a population of 9,000, right, you can't even scale that when it's an island. You can't think of that in terms of, because that's a whole nation. You need to have all infrastructure. So we need to build up from the bottom with speaking about sort of foundational roots of how that changes. And so, yeah, we've been really lucky. And so the guitar keeps me sane. So in between like writing stuff about AMR and investible healthcare, all those kind of things, I play guitar a lot. So, and for you, I guess the crossover is you've got World Health Innovation Day coming up, right? So huge fundraiser.
Yeah, we do. And before I tap into that, just give the audience like your GP by back. You're currently
yeah. That's the other thing. Yeah. So I have GP'd this week. I GP'd the first half of the week. And my specialism is within antimicrobial resistance, healthcare behavior, pathways. And most notably, while I was working in industry with Pfizer, I led the delinkage model for antimicrobials, where we actually value interventions by their value in the actual outcome rather than the volume that's used. So this is about value-based economics, value-based healthcare, and that really is the root and informing everything I do in consulting at the moment as well. So yeah, I mean, the cold face of the GP surgery at the moment, wow, everything this is a zeitgeist for the brokenness. There was a call for evidence this week, wasn't it? A call for evidence for the broken system. Well, actually, it's in the waiting room. It's in every consultation. It's in typing and how much we need to do. It's all of those things. And I think the key is actually collaboration. I think we need to work. There's 1.3 million people in the NHS. I think we need to be buddying up. I think we need to be doing things together and not in siloed rooms with a new piece of tech, because that isn't going to connect healthcare. And we must differentiate healthcare from health and health economics. They almost sit in different fields and we conflate them all the time. So that's a really important thing. I can sit at that interface, and I guess you get that. You understand that.
Yeah, no, it's fantastic. I found that, and you were asking about, tomorrow, for those who are listening and joining us, we've got our World Health Innovation Day. Basically, it's a celebration. We're trying to mobilize people around the world to get involved in physical activity, sort of to promote their own health and well-being. This year's theme is about mental health. We face huge challenges in the health system. I think we need to be very innovative. We've got to be very creative. We've got to look at the lessons learned from COVID as well. How have we engaged with local communities? It's fascinating to see the sort of change that's happening within the system, because there is a recognize, I think we recognize that the health system is under immense pressure. It's not sustainable, hence our topic today, sustainable healthcare and what's investable. If we look at the future dynamics, if you look at the sort of work over the last, say, 20 years, we've been looking for solutions that sort of patch up the current system. And I think the approach of the future, which is going to open up a lot of opportunity, is in this preventative model. Some of the work we've been sort of pioneering around health and well-being in communities, co-creating, giving people the tools to manage their own health and well-being. And there's going to be a lot of innovation in that space. And I think, at the moment, you might only get 3% of a $12 trillion budget going into prevention. But I think in the future, we're going to see a pivot, and we need to get to almost a 50-50 split. And I also think people need to understand that, 3.5 billion people worldwide don't have access to healthcare. We're quite fortunate here in the UK. We have that access. We can get treatment when and if it's available. And I say if because we've so much pressure on the system. So
yeah, I mean,
next, half an hour or so, we can get into that conversation. If anyone out there has any questions and wants to ask a question to myself and Tom, please do join in. Please chip in. But let's just start, Tom. I wanted to just start with something that really key. We've just gone through an election here in the UK. There's been an appointment of a new Secretary of State, and very ambitious. He's doing some great work, come out with some fantastic statements. And I also think the stability in government as well will help attract investment into the UK and wider afield. I think, there's a knock-on effect here. But the Secretary of State recently said, that the NHS was broken. I mean, that's the first question, Tom. Is it broken?
Well, I think we've got to think about progress, and it was set up from a range of institutions that were funding, almost decentralized to fund a central system. It was almost set up with that ethos. It's evolved into something that isn't that. So is it broken? I think it's evolving. I think there's confusing routes of funding, leadership at every level, and that goes through to the patient and the consultation. But if you've got lateral, you've got quasi sort of organizational things as well, it's confusing. I think the most important thing is is it broken? No, but it's not an organization. I don't think it fits the definition anymore of an organization as it stands, because it has a common logo and a common purpose. But beyond that, it has different systems, different employment, different suppliers of the sanitation. Is actually, we think about other organizations, and I think that's where we need to go. So unification and really that strict balance of innovation with sustainability. Because in the past, we can only think about that as an internal market where we set all of the hospitals in the country off against each other to say, we're better at doing this. That's completely at odds with the patient choice agenda, where we said, you can choose to go anywhere you want. Well, actually, if I have my hip replacement in, I don't know how many years, hopefully a few more from now, I should be able to choose to go to Truro or Newcastle and it just be the same. I'm not really bothered about the institution so much as the outcome.
Well, I think this is sort of like part of the question is that we'll have a lot of people who are viewing this, lower middle income countries, developing nations, people in the EU, that, there are so many different systems within the health system. It's very hard to navigate it. I think it's very complex unless you have detailed knowledge of how to navigate a health system. It can be very daunting. I mean, that's part of our mission.
You need an advocate to get through it at the moment, to understand the path to where you get to somebody.
Yeah, for sure. And I think that's critical. That's a critical part of and even when you look at the gaps in the system, so if we're looking for opportunities for investment, I mean, this, we talked off air recently about, you're talking about infrastructure. Maybe you can give the audience a little bit of an insight into the infrastructure opportunities that are there. And just a note that I've had, through my dealings in certain UN agencies, I think the number is something like 70% of infrastructure that we need by 2050 hasn't even been built. So we've got a massive opportunity for investment to go into that area, and particularly in the health sector, because we're going to develop these new programs of health and well-being that will all require infrastructure, And then, of course, one of the questions that I wanted to come to later on is around climate change and the impact of climate and health and how that will influence investment. Particularly, we're already seeing it around, if you look at the Mediterranean, it's becoming too hot, so there's going to be a opportunity.
Yeah, indeed, absolutely. There's so many points here. And going back to that Hurricane Beryl in the Caribbean, which got, swept away really under a lot of a distraction with elections and things, you know, that typically shows that we're not having hurricanes like that size at this time of the year. It's so abnormal. So what I would always say, because I do believe this, is I think antimicrobial resistance is actually the vanguard, or the, you know, it's at the leading edge or the nexus of all of those issues. You could, in terms of infrastructure, if we think about it as a commodity, to have a working antimicrobial, really the best thing of that is that you have patients that don't have infections that can go through your hospital with interventions, right? The value of that is untold. So we can think about these things as infrastructure as well. And I'll come on to that a little bit later. But antimicrobials also show us the leading edge of the danger of only volume-based investment. So if you invest in them and build loads and loads of them, you think, this is great, we're innovating, we're making more of them, there's more options for patients, the cupboards are full. Actually, it was inducing its own failure, and now they've become precariously investable, and that's changing. Because what we're starting to do now, and I'm working on this in depth with some fascinating people, economists and great thinkers, around how we define working antibiotics as infrastructure, and they definitely fit that definition. Now, when you then think of infrastructure in any kind of environment, you realize that it's investable. When that infrastructure aligns with productivity, it aligns with sustainable development goals, you then can see a common language for the whole world to understand what value is. So I think this is one of the key things, is when we're talking about value-based interventions, what is value? And so in the health of a person, that will be determined really by them. But what we have is an evidence base that's based on assets of intervention, of an agenda. So really the outcome is the important thing. That keeps productivity going, that keeps economies going, and that's really investable. That protects pensions, that's food security with AMR. And then the nexus of climate change and AMR is, you know, is quite a strong link, metaphorically within, you know, with both, but also they do certainly link. And we've got it particularly sort of in food production. When we think of emissions as well, it's not just carbon, it's runoff of pharmaceuticals, of bugs into water supplies. So yeah, we then start to think about infrastructure in its widest sense, and then it's like, that's very highly investable.
Yeah, and I think this is an important point to make, because so if you're sitting there at home and you're kind of saying, okay, what is Tom and Gareth talking about here? Like, you know, in terms of like, you know, infrastructure. Well, just think of it like your rail or even your buses. And you know, there's a lot of money flowing into zero emission buses, for example. Keep in mind that over the long term, there would be an uptick for local authorities, for example, because you'll be, and even the NHS and health providers, because you'll be reducing the prevalence of cancers. So these are sort of things that need to be taken into account when you're actually making those investments. That's sort of like where we want to try and bridge the gap and work with financial sector, work with investors. And you know, if you're listening in here and you're an investor and you're a family office and you want to make an impact, reach out to myself and Tom. And you know, we're trying to pioneer this space, and we have a number of projects which will address these issues. We are working with investors to actually, you know, make a sustainable health economy viable over the long term. We're taking this from a, you know, 20, 30, 40, 50 year approach, because that's what we need. We need to have long-term thinking. I think the point that Tom's been making around AMR, and maybe Tom, just do a quick synopsis, just give people just a layman's version of AMR and what it means within the hospital, because a lot of people will say, what is antimicrobial resistance? Because it's one of the topics that I don't think people are aware of, you know, and it's something that we need to be aware of, because if we are looking at infectious diseases as, you know, as a next pandemic per se, this is a big problem. And the numbers that we're talking about in terms of disruption to our economy is also enormous.
Yeah, I mean, it's a huge umbrella. I'm glad you picked up on that, because there's an opposite paradigm of AMR where we talk about stewardship, you know, sensible and appropriate use of these assets, of these antimicrobials, of these novel ones. And the economic model that is in play in the UK, that much of this world knows about, is where they're investable through the outcomes that they provide, including enablement. So when you have a working antimicrobial, an antibiotic, you enable people to travel through their cancer care, and so there's huge value in that. We know that's where the pocket of value is surviving that. The thinking is that I think there's a civic value of surviving cancer, probably greater than there is surviving infection. Sepsis and AMR feels almost like another person's problem for another day. Cancer is in people's minds and they're worried about themselves and their families. Actually, it's not just the other way around, but it underpins healthcare. We have healthcare institutions predominantly because of infections. We're in an era of that. So if we misuse antibiotics or antimicrobials, if we misuse them, the bugs just evolve because they're just evolving quicker than humans. There's loads of them, and they just randomly mutate to overcome the thing we're throwing at them. So it's natural selection. That means if you overuse or misuse a particular type, and that's in some particular infections, in gram-negative infections is the predominant issue, you actually lose value in the thing you invented to kill it. So, but what that does mean is that there's huge value in using them right. So within this round, we're changing the value message, very much so, to stewardship. So actually it's valuable to steward your antimicrobial and to have a surviving patient from infection and sepsis, and to have a patient that can get through their chemotherapy, for example, or their hip surgery, or their, and there you see where value lies. And that's why it's highly investable, because actually you just have to look at where the value elements are better.
Thanks for explaining that. I think it's important for people to note that, they need to understand the journey. But I think you've really, you've hit the nail on the head there around, AMR, sepsis. Sepsis is something that happens very quickly. You don't know, and like you say, cancer treatment is over the long term. But I want to just move on slightly now, because I want to kind of tease out a couple of areas. So, let's look to the future now, right? Okay, so there's all this talk, artificial intelligence, robotics, technology. What's your thoughts on that space? Because this is sort of like where we're being told to go down this sort of road of technology. I mean, I think you need a blend. I think you need to have you still need to go back to basics. I think, nutrition, you got to have healthy foods, you got to get exercise involved. And also you got to change behaviors. That's not all going to be driven by technology. But I'd really like to get your thoughts on that. What do there's a lot of scope for robotics. There's a lot of home help, bringing the hospital at home. That's going to be a massive opportunity.
Yeah, I mean, ultimately, we have to realize that unless you're connecting to more humans, whatever problem you've got, and have advocates, you're probably not going to achieve your health outcomes, whether you've got all of the apps or anything in the world. So it's about advocacy. So if that connects you to more people, or the advocates that are going to keep you well with company, you're not lonely, you know what healthcare looks like, you know what health looks like within groups, then anything that enhances that is a boon. It's a win. Whatever it is, whether it's a medicine, a technology, a diagnostic, or an AI tool. So anything that enhances that is going to be for the win. So I think where we talk about highly investable opportunities, it's not just highly investable, it's where the only investment is for the future, because we're proving that volume-based behavior in healthcare does not necessarily equal a good health economy at all. In fact, it makes some of them quite scary to invest in, when in fact the outcomes that you're after are actually really predictable. And with preventative health, you then have it. So I think there's space for everything. I would say I've been reflecting on this in the moment while I'm seeing patients at the moment. If you take the GP away from a person's life, there's the last bastion of your advocate that's there for you across every agency in the country at the moment. Literally, we've lost the central sort of clergy, the local baker, the Bobby on the beat. They're not there anymore. So you've got to realize we need to sway back to connection. Whatever
That's
round
so
that's
cool. Yeah, I think you're making such a valuable point here around advocacy. Because I think, my previous role in the Irish health sector, I worked with the National Haemophilia Council, and I worked with advocacy groups who were very well drilled. They did a fantastic job, the Irish Haemophilia Society. I think there's so much to learn from advocacy, and ultimately that's what drives change. I think a lot of people need to understand it takes a lot of commitment to get involved with advocacy. You've got to be passionate about it, and you've got to have a vision, and you've got to follow it through. It's the same
with advocacy, right? It starts from, and if you can't self-advocate through a health system because it's complicated, wherever it may be, then actually you ideally need another person who's your advocate. If you don't have either of those, your health outcomes from every single malady will be worse. So it's actually about buddying up and having people around you, definitely, for your health outcomes.
Yeah, this is really great, because I think this brings us into investment, in terms of I'll be honest, last 2 years has been a learning curve for me, because I've been trying to bridge into the financial sector and look at how do I engage with investments, and how do I bring the health sector to the front door of the financial world, and how do we cross-pollinate and work together. So and that's about buddying up, like you said. So I've had to learn by partnering and trial and error, and it's difficult. Like it's not easy, and it's very much like navigating the health system. It's difficult, but the fruits are there. Do you know what I mean? Like we're beginning to sort of like see the fruits of this hard work, of this advocacy. And it's very interesting, because I've been meeting some investors recently where we've got some great traction, and we're going to start to work together. And you're right, it's about that buddying up. It's about having, it's sort of like you find someone who has the same values as yourself, same vision, wants to change things, wants to improve people's quality of life, wants to deliver healthcare, which is sort of like open source, transparent, builds trust. This is sort of like what we had envisaged and prototyped in the UK since 2015 here in Cumbria. And now the opportunity is to scale that model. Like even being able to host this webinar with yourself, you're able to disseminate that information, and then people can learn, and we can buddy up, and then we can cross-pollinate. I just had a fantastic meeting with colleagues in Italy during the week. And the challenges for healthcare, maybe just to put things into perspective, I met a European country during the week. We were discussing elderly care, for example, loneliness. I mean, these problems are crippling their economy, and basically a third of their budget is going into health and well-being, and they need new models of healthcare which will offset this over the long term. Otherwise, the country will become broke.
There we go to the highly investable opportunity, because actually the things that you need to make that happen are far cheaper than a lot of stuff that gets invested in now. It's like far cheaper. The return is actually going to be much more likely. But our current evidence models, our valuation models are based on single interventions, not multimodal community interventions, right? So if we're convinced that we have to keep looking for evidence for things that keep people well, we have to look historically at humans of what kept people well, right? Through pandemics. It's nothing to do with some things.
Sure.
Yeah.
And this is interesting, because like when you say our measurement, our evidence, I mean, this is one of the things, you have a pilot program, for example. I can give you a great example. When we were, there's music and arts in a particular hospital that I worked in the past, and there was a pilot project for 1 year, and the pilot project ran for about 4 or 5 years. But we knew it worked. Do you know what I mean? We knew that the musical intervention worked. It improved people's cognitive ability, so on and so forth. But we still decided to cut that. You know what I mean? Like, so there is flaws in what we measure.
Yeah, I mean, who knows? The other thing is to assume that a mode of therapy is the answer. It might just be the person didn't like the guy that played piano, right? Literally, this is what people don't always realize. I don't like Hospital X. It could be just on a Thursday you went there and you didn't like it. We need to really move away to just, I need this outcome. Thank you for providing the service you do. I now need this. So when you empower people to go through it, they realize value. And so when we come into this thing where you keep talking about highly investable things, I don't think it's so much that it's highly investable. It's like the only way that you'll be able to invest in a sustainable world. Is actually the only way to do it is actually through things that sustain. And actually the multilateral development banks, they get this so well. They really, really understand this, that it's longevity. It's about the long game. And when you think about security, productivity, and that relates to pension security and productivity in your nation, I mean, that's so investable, isn't it?
Well,
Right?
this is where, so let's just go through this. Okay, so if we start from early years, and if we start, say, shall we say, like working life, and then retirement age, and then if we take the environment, for example. So let's just go through this. So, Tom,
It's good.
early years, right? So mental health, well-being, huge challenges for young children at the moment. I mean, your thoughts on where are the investable opportunities there, and I'll give you my thoughts.
I think emotional intelligence, just saying to people they can say how they feel without being judged. That's it. That's all it is. You embed that within families. That should be obvious. We do that at the end of school as well. You're allowed to have any emotion. You're allowed to be angry, sad, shameful, elated. It's not ill health. Just change the rubric on this, because mental health is the presence of health. Mental health is not your disease. And so even just changing the semantics, say, but you'll hear people saying, I have mental health.
Yeah.
And you almost, within anything else, with cardiovascular, you'd say that's brilliant. So we need to change the whole thinking of it, and actually move to people being able to just connect and say what's going on for them, because actually it's not of any risk to anyone how people feel.
Yeah, so that's great. So that I agree totally. That's the sentiment in terms of the psychological side of things, and we do need that change in narrative for absolute sure. We need like leadership with vision that can pivot on that and actually articulate just what you said there. Keep it simple.
Yeah, keep it simple. Educate. That's really at that stage. Just really educate, embed, and make those the pathfinders of the future.
Yeah,
Of change, right?
so what I'll look at the infrastructure side of that as well. So you'll need digital tools that can enable that to happen, shall we say, and you need infrastructure to support young people. So you need your playgrounds, your parks. You need all your water. You need clean water. These are sort of things that are critical as part of that as well.
And they're accessible for them as well. That's the thing. Accessible things that keep you well, and about it. That's the key thing.
Also, when we go back to the sort of, so we're covering the early ages here at the moment, and even preconception, and even like around how do you support families, going through birth and raising children. That's a critical area for me that needs investment. I think that's very low hanging fruit. Also, won't cost a lot of money, but would have huge long-term effects on our economic output.
And it already exists, but it just needs a bit of a change in how it's happening. So these contacts, it's already there. It's not anything different. If you look at it, it's actually not a vast change. It's sort of just changing how you're doing it. And with those different things that you can do, those utilities, you can achieve those outcomes. If we think about clean water, the impact on GDP in sub-Saharan Africa is absolutely huge from just not having clean water in a hospital. You can literally, just by having clean water, you could save vast percents of GDP in sub-Saharan Africa. That's from water aid. It's amazing, So a lot of these things are much more simple than we think. So yeah, in terms of this one for mental health in early years, yeah, I think this is some, like you say, low hanging fruit. Keep it very simple. And don't pathologize everything. Remaining in your health actually the economy.
Yeah, for sure. And then, so like if we move on, then let's just say adolescence onto say working age, and then into retirement age. So what's your thoughts there? Because we have a lot of people who are unhappy in work, for example. We have mental health issues that cause huge problems. We have it in the health sector. One of the highest rates of suicide is through medical practitioners, unfortunately. And these are huge challenges that we face. Interventions that you would see there from the future perspective. I mean, we do have, certain interventions that are available, but from your perspective, Tom?
Well, on this, I think that you just have to live your purpose as an organization. Most organizations are saying they're doing these things, so why is there a problem? So actually live your purpose of diversity. Diversity is in the moment. It's every person. How are you? So it's just 3 words. How are you? And so I don't see it as that hard. But what is very important is that when people are in need, we are there immediately, because it's people's time to access to intervention that is the issue within anything. It's not the intervention, it's how quickly they can get there. So I would say that how people can access that, you can do that by giving more things to help people, but you can also do a load for empowerment so they can find the right thing. So if you've got people in this age group that can navigate, then they can find the right thing. A really good example, I always talk about this, is actually STI, sexually transmitted infection in the UK. People understand what exists and they travel through a system because they're empowered. That's possible with nearly every healthcare problem. And then you meet people at each node. So yeah, I think that's about empowerment. I'd say that the word that captures all of that.
What I'll do is I'll cover again. So let me just set the context for people. You know, and let's just take the UK, but this is a global context. You know, we're struggling for staff and recruitment, and you know, in terms of elective surgery, we've millions of people waiting for appointments. So I think where the opportunities will lie is that empowerment, as you talked about, Tom. So bringing healthcare at home, but the tools in that we develop at the home have to have a purpose. They have to have a meaning. And also this community engagement. So I think we've been, one of the things that struck me yesterday, I seen a LinkedIn post, and you know, we were talking about future of healthcare and how can we empower people and how can we build that community. And that's something we have been doing since 2015. Like we finished our prototyping in 2018. We showed that by bringing communities together, there is a fruitful outcome, not only for the local community, but then you can co-create those solutions with the NHS and other healthcare providers. So I think on the infrastructure side, there's so many opportunities because you're going to need a lot of technology, but also as I go back, the environment needs to be right. We need to be conscious of how we're building our environments, particularly in the future. We cannot use tools or means or products or services that are not doing our health any good. And that's what we're doing at the moment. We're effectively killing ourselves.
Well, I think that's it. That's stewardship. So that again comes from the antimicrobial stewardship. You can compare it also to psychotropics, antidepressants, similar behavior. You know, it's actually, that's not ill mental health necessarily. It's just somebody that can't access all of the things that keep them well. So I would say there are some very obvious tools there to steward people in the right direction to get the appropriate thing, because something's only valuable if you use it appropriately. You know, and that's it. It's using things appropriately. So stewarding as well, cutting down the use of some things, you know, encouraging the use of others.
And that's where we need the innovation. That's where we need these new solutions to come to the fore. Like, so, and we need to be able to spread that innovation, not just locally, but globally. Let's go to the last sort of area, and we can cover off a little bit the environment as well before we wrap up. Loneliness is a huge problem, elderly care, and we've massive problems. I was just go back to some of my conversations during the week, talking to, you know, various agencies, governments about, you know, the huge problem of people being lonely now. You know, that social connection's not there. Like, you touched on it. I mean, social connection we're social beings. We need that social interaction that gives us a purpose in life. Where do you think the opportunities are there for investment?
Well, I think this is where the caveat lies, to say that technology doesn't necessarily make people connected. So if you don't use technology right, if I don't use this correctly, I could end up more disconnected from the world, right? So it's about stewarding what you've got. So I think that's really where it lies, is that there's definitely room for technology, for all of those things we've talked about. I guess how you fix it at the moment is different to how it would be if you have those other people evolving through what we've just talked about as, you know, newer paradigms. But to save it, I think we just need to realize what's out there. So actually living in Bristol, a very connected city, a lot of the thing that connects you is just a directory of what's going on, a bit like the Yellow Pages, you know, just it exists. The stuff exists. There's a lot of this stuff happens like because you're behind some of this, right? You know that that's the case. Your network across the world, you know it. It's just that people can't find things on a directory. So it's really just revealing to people what's available to them. But yeah, loneliness is really hard. We've got this strict balance of pushing hospital at home and community models, but you know, we can't conflate that with just because you're out of hospital doesn't mean you've got community around you. So we need to build up community as we get people back into their homes as well.
And normally that will mean the opposite, actually. You know, so when someone is discharged, I mean, how many people in the community even know they're in hospital? You know, these are sort of things. I mean, unfortunately, we all
Yeah,
have
the
different.
boundaries are changing. That's why the infrastructure thing you mentioned earlier of like, it depends. You're going to have multimodal needs, aren't you? So if you think about the pandemic and vaccination and testing booths, you know, we had things built out in places that there wasn't a healthcare facility the week before. So actually, you need to be able to flex as well with surge demand for pandemic preparedness. You know, that's also important, that you have to have permanent infrastructure. And I guess whoever's doing that balance book on how much is needed needs to balance how well we look after the community and get people back to there. Because if you do it right, hopefully you wouldn't need huge amounts of new buildings.
Yeah. Okay. So this is great. I mean, well, let's touch on some areas. Let me just put to you, like, so we're facing climate change. You know, rising temperatures. That will obviously open up opportunities for health tourism. I recently came from an event in Malta where they were talking about setting up health retreats, quite large ones in Iceland and in Greenland. And the Nordics are starting to pivot as well. I understand that there's a lot of investment going on in Denmark at the moment because Spanish residents are holidaying in Denmark now because it's become too warm. I mean, there's things like that that are going to open up opportunities for investment. And I do believe that people over the next couple of years, as AI is being adopted a bit more, will have more time sort of to take time to look after their own health and well-being as we become more aware of the impact of health and well-being on how we actually produce an output for GDP, for example. And investors, I think, are beginning to see this. I mean, if you look at the UK, you've over 2.5 million people suffering with ill health. The cost to the economy is about 150 billion annually. I mean, these are huge numbers, you know, so we have to start to address these causes. You know, Tom, over the next couple, you know, some final words from yourself around, like, you know, where do you see these pockets of opportunity in terms of, you know, as I said at the start, 97% of the budget is going on managing disease, this open space now of preventative medicine, values-based care, you know, new job creation. That's what we need to be thinking about. There's going to be lots of new jobs in this new sector. I mean millions of new jobs. We see it with link workers, for example. But when we start to embed that into the community, it'll mushroom and grow more jobs.
Yeah, absolutely. The other thing is about doing economic models on broken areas at the moment. It's very difficult to prove because actually the status quo is hard to prove that it's, you know, the expectations within it. So I think that this is vital to realize how you can actually do things. Just simplify, really. I think simplifying is absolutely key to it, and investing in the right things. And that if you community empower people within work or communities, they'll be more productive, and then productivity is good for economies. It's good for health. So it's one and the same, and that's why it's highly investable. Healthy people are productive people remain healthy. It like gives off, and it's probably synergistic. You know, it's probably quite we probably can't imagine how good it can be, and that's the thing. That's why I believe it's highly investable. And again, it's not left field. These things happen. They happen. It's just we probably haven't got the directory to link them at the moment. Well, so they're all happening.
You know, the encouraging thing is they are happening. It's important that there's generational wealth being transitioned. A huge amount of wealth is being transitioned across families at the moment. They'll play a huge role. I think, you know, younger generations are a bit more purpose driven. So there's going to be a lot of money flowing into sort of purposeful, meaningful businesses. So that's a big opportunity. I just want to say thanks, Tom, for, you know, unless do you have any final thoughts? Do you have any final thoughts you want to, before I wrap it up?
I'd like to sort of hear some things about World Health Innovation Day, or a couple of examples of things we've talked about today that you've already done or that are coming into fruition. I think that would be really useful to see the application.
Yeah, so I think look, I'll give World Health Innovation Day another plug. It's on tomorrow. Look, if you're out there, if you're listening in, if you're taking part in a park run, or you're out with the family tomorrow, tag us in a post or send us some photographs. It's for everyone. We have activities in Argentina, Peru, Latin America, Africa, Kenya. There's a football tournament taking place in Kenya. We have a number of teams that are registered. I myself am going to take part in park run if my Achilles is all right in the morning, but then I'm going to get out on a cycle as well and do some cycling with the kids. You know, there's a lot of people involved. We've got people from all over the world. I have to say, we've had tremendous support from the Balkan regions around Croatia and that. You know, there's people mobilizing all over the world. This is our first year. We started it myself, Hannah Beecham and Gordon Miller, you know, Red January and Ride for Freedom, respectively. We basically came up with this vision where we want to try, sort of empower people to improve their own health and well-being. So we just created this sort of day. We want to make it a monumental day. Eventually, what we want to do, we're working closely with charities as well, Tom, like you mentioned, the charities, like use it as a day to fundraise as well. Like, so, you know, people can go out and do a sponsored walk, or, you know, people can do a sponsored cycle, or if you're playing hockey, and I mean, even whatever you find it gives you sort of like a great sense of purpose or well-being, let us know about it. We want to get involved. We were talking to some people about virtual runs. You know, we've already got next year's day in the diary, you know, so that's already locked in, 2nd of August. And anyone who wants to know any more, just check out our website, wis.world, and, you know, you'll find out more. In terms of implementation with WIS, I can say that I am coming to the conclusion of like negotiating some investment for our growth. So this is a great moment for myself because it's taken a long time. But we are about to you know, sort of get into the crux of it, and actually what we developed in the UK with the pound invested 36 back and how we can create new jobs and build this ecosystem out. That's actually coming to fruition, Tom. I've had some incredible meetings this week where we're going to launch in Italy in September. We'll have events around Italy in January next year. That's all in the pipeline. I'm truly inspired. This week has been an inspiring week. It's a great way to finish on a Friday, is to have this webinar. I've been looking forward to these conversations.
Yeah, me too. I mean, there's huge agendas around this year at the moment, isn't there? So, I mean, I think even for World Health Innovation Day, you know, a lot of things are being lost in the traffic of so much change and reform. So to have something that centers on it and it's going to have a legacy, it's so good to see this at the day before the first one. And like you say, you know, you're then franchising with other people that are doing good anyway. You just go, actually, well, if you're doing a park run, you're doing it. You know, that's it. It's not like anything but that.
And I think that is healthcare. Like, so we need to realize, I think this is what we don't, and people don't understand. Like, healthcare is not the health system. It's actually what goes on outside the health that determines your health. Like, you know, so the people you hang around with, that has a massive impact on our health and well-being. The food you consume, the way you go to work, you know, everything the music you listen to, you know what I mean? So
and that's it, defining that difference between investing in healthcare and investing in health. And actually the things that are both of those, when you invest in healthcare that lead to better health, that's a healthy health economy. And then you can relate good outcomes to it. And that's highly investable, right? That's the mix of getting it right. Just because you know all of everything about health economics or all of health or all of healthcare management, it doesn't mean that you're doing them all. So we need to connect. It's the language between those that then is the magic mix of making it work.
Exactly. And then it's that, you know, because we live in a very hectic world. Everything is very consciously pushed forward. Everything is rushed. And I think that's where we need to take a step back as well for our own health and well-being, is actually being able to have the time to think and make informed decisions. That's critical.
Yeah, I mean, the biggest thing you can do for another person's health is get well yourself, right? That's the most important thing you can do. Is the only one you can really control is your own. And that's also really important to be mindful of, is that you don't have power over change of others, but you do have power over your own, you know, own behavior, and that inspires people. So that's it. Stick to your own sort of values, and then it sort of propagates. And clearly that's what you're doing. And
well, at the moment, you know, like I think the first thing I did this morning, because I'm conscious of that as well, because you can't work all the time and you need to take a break. I think when I first started World Health Innovation Summit, because I obviously left my job and I took a big risk, and, you know, we're going out on your own. But the last couple of months, I've been trying to focus on my own health and well-being as well, which is critical, you know, so that's what everyone should be doing as well, you know, and just get the balance right.
Definitely. Well, it's great weather, a great weekend, and yeah, it's so good to catch up again. And yeah, I'm feeling a lot of like reasons to be cheerful. That's a bit of a theme for this year around this space, because there are many. We're not always seeing it, but now you people like you are revealing it. So thank you.
So the other thing is, Tom, so let me just tell everyone, like, look, thanks for joining in. If you have any questions, pop them in the chat. I understand we lost X actually, because I didn't realize you had to be on a premium for this one.
Okay.
Normally, so we'll try to sort that out anyway. But look, our next webinar is Progress Marching Towards Supply Chain Fidelity. It's on August 30th, 1 p.m. And then we have the next one after that is Enablement. That's the last in our 4-part series. What does value mean for citizens, communities, investment, and industry? So that's September 13th, 1 p.m. Find out more information on wish.world. We'll get some advertisement out over the next few weeks. For myself and Tom, have a fabulous summer. And I hope you've enjoyed today's webinar. I hope you enjoyed the first one as well. We certainly did. This mini series, Standing on the Shoulders of Giants, insight, we've been covering investment today in sustainable healthcare. But all I can say is, Tom, thanks very much for joining me, and thanks for everyone who's listened, and look forward to our next webinar in a few weeks. So thanks.
Gareth. Bye all. Thank you.